you will start by telling us maybe your name and how has been the experience with, how has been the journey with being a caretaker of these individuals who maybe stays with sickle cell disease, because sickle cell disease, it is not treatable as per se. You have to live with it for the rest of your life. So how has that journey been? How has been the experience in the field? Maybe I think it is voluntary work. What actually motivated you to maybe get into this voluntary work of being a caretaker?
My name is Veronica Bitter. I'm a mother to a 15 years old child living with sickle cell disease. And actually, this was my inspiration of registering an organization that supports sickle cell patients and also does a lot of advocacy, education, and awareness creation around sickle cell disease. If I may talk about my journey as a mother to a child living with sickle cell disease, as you have said, it's true. It is a life-threatening, incurable disease. The only cures that are currently available, that is bone marrow transplant, and now gene therapy that has only been licensed in the US and in the UK. We still don't have it in Africa. They are quite expensive. Treatment like bone marrow transplant costs about 7.5 million Kenya shillings. And the new gene therapy that is just coming up is costing 2 million US dollars, which could be about 260 million Kenya shillings. So that is just out of reach of many, a bigger percentage of the population. So my journey as a caregiver, initially it was not easy, because when my child was diagnosed with the condition, she was 1 year and 11 months. I used to visit hospital almost every week, and admissions were so many. So I delved into a lot of reading concerning management. So my focus was especially on social determinants of health, in addition to the medical support that she could receive so that she could live better without frequent sicknesses and frequent hospitalization. And I came to find out that this condition can actually be managed. There is what we call crisis in sickle cell disease. It is usually accompanied with excruciating pain, and a child must always be admitted whenever there is crisis. It's a very common occurrence under sickle cell condition. So that requires medical attention, obviously, but there are also other ways that the condition can be managed. As a caregiver, what has worked for me, besides the medical care where she takes her daily medications, the main one that we use in Kenya is called hydroxyurea. Then there is malaria prophylaxis drug called Paludrin, and we have Pen-V. Okay, I don't use Pen-V. I don't use any prophylaxis treatment. I only take her to the hospital when she falls sick, but she takes the hydroxyurea each and every day, like twice a day, given her age now. My main management method is actually nutrition. And I came to realize that in the early development of a child, there are certain social determinants of health that when they are practiced, then this child is going to live a fairly normal life. As I'm talking right now, my child has not suffered any sickle cell crisis for the last 9 years. And this month of June marks 1 year before visiting a hospital because she has not fallen sick. So we must have a supportive environment in the family first and foremost, because that will always determine the quality of life this child is going to live. Adequate nutrition is extremely important. So I used to read stuff on food substances that improve blood. Yeah, because you know sickle cell is a disease of the blood. The red blood cells of sickle cell patients get destroyed in 2 weeks, while the normal red blood cells is supposed to stay for 120 days. So the food that we give them is supposed to be those blood-building foodstuff. I don't like supplements because like they are chemical-based, they've been processed, they are not fresh, and probably even nutritive value may not be as good as the natural, fresh foodstuff that we get. Yeah, so I came to learn on how to provide adequate nutrition for my child, provide a very supportive family environment, and early education about the disease so that she can know how also to transition from parental care to self-care. Yeah, so she knows what to do, what to eat, the importance of fluid. So she's always drinking fresh water. Whenever you meet her, you'll find her carrying a bottle of fresh water that she sips throughout the day because the red blood cells sickle and they clamp up. The only thing that can maintain the fluid status is actually fluid. Yeah, so, and I also pray. I pray a lot for her because I believe there is always divine intervention in our lives for benevolence. Yeah.
No, thank you. That is just wonderful. Now, being a caretaker, maybe you have your organization that you run, maybe to give some mitigations to this positive energy to these individuals living with sickle cell disease. Now, what are some of the things that maybe a person living with sickle cell disease or an individual living with sickle cell disease should do and others that he or she should not do?
Okay, we will begin with those ones that they should do. They need to maintain a positive mental attitude. Have goals that can drive them in life. Yeah, so that they focus on achieving their goals, and you know that will give them less time to think about their condition. When they are pursuing their goals, they will remain positive. Okay, as I said before, they need to be careful about nutrition. And nutrition for any human being is important in maintenance of good health, like eating of balanced diet. But for a sickle cell patient, there needs to be more proteins because those are the body-building food substances. Of course, a lot of clean water, fresh fruits, fresh vegetables, and they also need to learn their bodies so that they are capable of knowing if a crisis is on the onset and carry out mitigation measures by visiting their doctors or increasing the amount of fluids, going into a relaxation mode. Yes, and with that kind of lifestyle, they should be able to live a normal life with no sicknesses or hospitalizations. What they are not supposed to do, again, as nutrition is concerned, they're supposed to avoid commercial juices at all costs. The sodas, the commercial juices, the tinned foods. Yeah, because in commercial juices, we have preservatives. I think there is this one called sodium benzoate. It has been proven that it aids in the clamping up of the sickled red blood cells, thereby bringing about crisis. And it is usually accompanied with excruciating pain. These people are supposed to avoid stress at all levels. Learn how to stay, or to improve the mental wellness, because you know, as a lifelong condition, definitely as a human being, these people may suffer stress. There could be a form of depression, and the frequent pains may also make them hate life instead of loving it, on the other hand. Yeah, so those are some of the things they're supposed to avoid as much as possible. They are also supposed to avoid extremes of temperatures, either very hot that will lead to evaporation or sweating and loss of fluid in the body, or very cold temperatures that may lead to crystallization of the red blood cells within the vessels. They're supposed to avoid strenuous exercises because one of the things that characterize sickled red blood cells is insufficient transportation of oxygen, because that is the function of red blood cells in the body. They carry oxygen from the lungs, and through blood, they transmit it or transport it to all parts of the body issues. And you know, oxygen is actually the engine that drives the metabolic processes in the body or in life that supports life in general. Yeah, so they're not supposed to take part in very strenuous exercises, but at the same time, they're supposed to get involved in moderate exercises to improve on blood circulation and thereby delivery of oxygen to the body tissues, delivery of food nutrients to the body tissues, and removal of waste products to the excretory organs in the body. Yeah.
Now, thank you so much. There's that myth that maybe the community has towards those living with sickle cell disease, that maybe they don't live beyond 18 years. What do you say?
It's actually a myth. It's a misconception, and that has contributed greatly to negative reception of sickle cell warriors in the society. And you know, that is also a very significant social determinant of health. So these are some of the things we are trying to do in our awareness creation and education programs, where we engage communities and we educate them. As an organization, one of the activities that we carry out to debunk this myth, we look out for sickle cell warriors who are grown-ups, professionals, married with families, great business people, 50 years and above, and we bring them together in a program we call Warrior Speak programs, so that they speak. We carry such online webinars to debunk the myth. They come out and show themselves. Here we are over 50 years. We have master's degrees. We also have PhD holders. They've gone through education system successfully. They are married. They've given birth to children as females. Yeah, they've carried pregnancy successfully and given birth to their children. We have great business people. We have owners of organizations like mine as sickle cell warriors. So they are living their lives to the full, achieving the goals they set for themselves, having families, maintaining jobs, and they've turned out to be very valuable members of the community or of the society, even globally. And we have quite a number of them. Yes, so that particular program we created to debunk such myths and misconceptions so that we can change the mindset of the population. And that exists also in the family. And so there are some families, whenever their children are diagnosed with sickle cell disease, they leave for their children to die. So there is some sort of neglect, because after all, they are going to die. So such programs are actually changing mindsets, and now family members are providing support for their children and focusing them in long life and achievement of positive goals. And so they are mentored even to be leaders, future leaders of the society.
Thank you. As maybe a member of an organization that deals with these individuals suffering from sickle cell disease, or you as a person, as an individual, as a caregiver, that mother, that father outside there who's realized that, you know, this my son, this my daughter is suffering from sickle cell disease. And, you know, having in mind that treating this kind of disease is expensive, maybe what advice can you give them?
We have so many of such. We have so many vulnerable families affected by sickle cell disease. So we carry out several outreach programs, and we are always in partnership with the county government health committee members and health practitioners, both from private and public hospitals. We encourage them, first of all, to have NHIF, to register, and have NHIF card where they can access affordable treatment using the card in public health facilities. That is one thing we do. And actually, from last year, we've been mobilizing people. We've been mobilizing communities to register for MARWA. Yes, there is this health support by the county government of Kisumu called MARWA. And there are 7,000 slots reserved for families living with sickle cell disease, where they only pay 1,600. The county government tops it up for them, and they can have free medical services in government health facilities for 1 year. So such collaborations are actually bringing a lot of reprieve to vulnerable families living with sickle cell disease. They only have to pay 1,600 for a whole year, and they access treatment, plus the rest of the families that are not having the disease, courtesy of this child with the condition. So those are some of the measures that we have put in place, and they are working. Yeah.
Maybe before you give us your parting shot, maybe a word to the county government and maybe the national government as far as sickle cell disease is concerned.
Yeah, let me begin from the county government. Yeah, we have to appreciate the efforts that they have made to make treatment affordable and available for sickle cell patients. But we need this devolved into sub-county health facilities, the level 2s, the dispensaries, so that sickle cell patients don't have to travel to the county's referral hospital. They can get quality treatment near health centers where they stay. Yes, that is what I would tell the county government of Kisumu, where I live. Yeah, nationally, there are several measures that need to be taken. They need to have a budgetary allocation for management and control of sickle cell disease. I'm very passionate about primary prevention so that the number of sickle cell patients born can reduce each and every year until we get to a point where it is reduced to zero, because there is awareness creation, there is education. And some of these things can only be done at the level of national government. I want to give an example of an idea that I have in my mind. If the national government health management team can collaborate with telecommunication organizations like Safaricom, Airtel, Telcom, so that they collaborate and make messages, multi-level messages, that are distributed to all Kenyans who have subscribed, with these telecommunication organizations, as far as education and awareness creation is concerned. And one message that is passed to the community is to ensure that they take all their premarital age children for screening and testing for the presence of sickle cell genes. Because when you are a carrier like me, the reason why I gave birth to a child living with sickle cell disease is because I carry the sickle cell gene, but it is one. One is normal and one is defective. So whenever the defective gene is in the company of a normal gene, the normal gene dominates over it, so it does not express itself. So you are normal in every way, and you cannot know that you have an abnormal gene for sickle cell disease. The same to the father. Yes, so both the parents must be carriers of this disease for them to give birth to a child living with sickle cell condition. So the only way we can reinforce primary prevention is through early screening and testing for the presence of sickle cell genes among the premarital age, newborn screening, adolescents, when they are still in primary, so that if they are found to be carriers, they are given appropriate counseling and education on the future choice of a marriage partner. So they will know that this partner must also go for testing. If the person is a carrier, I would say they would rather break that relationship, because sickle cell disease is expensive and difficult to treat. It does not have any affordable cure. So as the Bible says, that a wise man sees a problem and runs from it, but a fool goes on and is consumed by it. We will be wise when we know. Yes. Yeah, so that we make right choices of marriage partners. There are so many things that we need as far as health infrastructure is concerned. We don't have those diagnostic centers. So apart from doing national messaging to all the subscribers in our various telecommunication organizations, telling them about sickle cell and mobilizing them to take their children for genetic screening and testing, the big question, the elephant in the room, where? Where? Yes, because such diagnostic equipments are not found in government hospitals. Yes, they are found in private hospitals, and they are quite expensive. At the moment, they're about 6,000, 7,000. That is confirmatory tests like electrophoresis. Yeah, so if we can have these diagnostic centers also established in all the sub-county hospitals so that they are accessible, then we will be very effective in our advocacy and community mobilization work of advising families to take their children for screening and testing for the presence of sickle cell genes. Yes.
As we come to an end, maybe your parting shot, a word to those individuals living with sickle cell.
I want to tell them that people living with sickle cell can live to adulthood and beyond and lead healthy lives without frequent sicknesses with proper management that is holistic in nature. Yeah.
Thank you so much for your time and maybe sparing you a minute of with us to maybe educate us on how your journey has been as far as being a caregiver of sickle cell, those living with sickle cell disease is concerned. We appreciate for your time. Thank you. Asante.
You are watching Media One International, always fast and fast. Like, share, and subscribe.